Hi, how are you doing today?
Good.
Alright, I'm Elizabeth. I'm a student physical therapist assistant at NWTC. Can I get you to verify your name and date of birth?
Bert Olson, 7/26/92.
Alright, so it sounds like today we're just going to be using some ultrasound treatment on your wrist. What that entails is I'm just going to be using my ultrasound unit to massage and use thermal heat to help your tissues in that area. Do I have your consent to do that?
Yep.
Okay. So before we start, I'm going to be going over a brief health assessment. Do you have any superficial implants in your wrist?
No.
This isn't an acute inflammation or anything. This is a chronic disease.
Yeah.
Okay. Do you have any active infection processes going on right now?
No.
No. Okay. Is the skin numb? Do you have anesthetic skin?
No.
Okay. This isn't at risk for cavitation. It's not over the eyes, spinal cord, or a pregnant uterus. Do you have increased blood circulation or deficient blood flow in the area? No?
No.
Okay, do you have any deficiencies for blood circulation?
No.
No? Okay, so, and it's not in the anterior triangle, so I think we should be good to go. I'm going to do an initial assessment of the area. Looking at the wrist, comparing to the other wrist that is holding the camera. Skin is intact. Scar tissue is well approximated. There is no swelling in the area. We can say we did range of motion, manual muscle testing. And do you have any pain today?
2.
You're at a 2. Okay, we're going to try to drop that even lower, okay? All right, so first what I'm going to do is I'm just going to do a simple pressure test. So I'm going to have you close your eyes. Can you tell me which one's deeper, 1 or 2?
2.
1 or 2?
2.
1 or 2?
2.
Okay, now we're going to do it again, but we're going to do it with cold. So we're going to close our eyes again. If you can tell me which one's colder, 1 or 2?
1.
1 or 2?
2.
1 or 2?
2.
Okay, you passed. Way to go. Before we start, do you need any draping or anything?
No.
No? Are you ready to go on with the treatment?
Yep.
Okay. So, I'm going to roll up my chair here. I've got your arm propped up on a pillow. We're going to say it's about heart level. I've got my medium here. We're going to squish the medium on. And I want to get my ultrasound unit on the skin and moving around before I start messing with any intensities or anything. Okay. So we would pick we're going to say this is my ultrasound unit screen. Maybe. There we go. We would pick ultrasound. Since this is a smaller tissue, it's not really deep, I would pick 3 MHZs for the 2 centimeter head. Duty cycle, since we're going for thermal, I would pick 100%. Treatment time, we're going to say 8 minutes for billing purposes. And then I'm going to turn up the intensity to about 1. And if he tolerates intensity well, we'll keep it there. If it's too intense, we can turn it down. Or if he doesn't really feel anything at all, that's fine too, because he's not supposed to feel anything during the treatment. Now, then I would start turning up the intensity. We're at 1. You feeling okay?
Yep.
All you can feel is me massaging you with a ultrasound unit.
Yep.
Okay, so I'd press start on the machine. We would do this for 8 minutes. Now, if you were feeling a superficial burn, I would add more medium. If you were feeling a deep ache, I would have to move my sound head faster. If he was feeling just intense pain, I would decrease the intensity. So, beep, beep, beep. It's been 8 minutes. We turn off the intensity first, and then we turn off the machine before we take the sound head into the air. So then what I would do is I would take some towels and wipe off the area. Okay, and then we do a reassessment. Okay, how's your pain doing now?
1.
Oh wow, we went down 1. I would reassess compared to the wrist holding the camera. There would be no edema. I would look for any irritations from the medium or the sound head. There is none. We said pain was lower, skin is intact. We can say we did range of motion, manual muscle testing, and that all went well. Reporting to PT, we would say patient was in long sit with arm propped up to heart level. We did an 8-minute ultrasound treatment of 3 megahertz for the 2-centimeter head. Patient tolerated treatment well. Intensity was 1 watt per centimeter squared. Pain was decreased for the treatment, and we will continue to use treatment at further sessions. That's the end of